Your lymph nodes aren't swollen. That's good.
Maybe Dr. Chase should check.
Sorry, mate. Hands full.
He's too pretty to be straight. You ever done any modeling?
Does anyone actually fall for that line?
Every day. Why do you think I became a photographer? I'm guessing you guys didn't think about dating on career day.
I love my job.
Really? You seem more the find it exceptionally satisfying type.
I'm not sure there's a difference. Your mom died of diabetes. How's your dad's health?
Last I heard, he had cirrhosis. Love is love. Satisfying is social validation. Fun can wait.
I have fun.
Yeah, she got some scheduled for February. Last you heard, your father?
He threw me out when I was 16. It's just as well. I got tired of getting BB guns for my birthday when I'd asked for a Barbie.
Dads can be real sweethearts.
Sensitive and cute.
He's cute. Your tox screen came back positive for...
Crystal meth and ecstasy.
Recreational drugs are dangerous to begin with, but for someone with HIV...
I didn't mistake them for vitamins. I'm a PNB boy. Party and play. Drugs and sex. You don't approve.
Does the sex include condoms?
If he's negative, sure. If he's positive, why put on a raincoat if you're already wet?
You could get hepatitis or another strain of HIV.
Or I could get hit by a bus.
AIDS isn't a death sentence anymore.
I don't want to have any regrets.
How long have you been coughing?
About an hour or so.
Try to take a deep breath. What is it?
I think it's blood.
I recommend post-exposure prophylaxis. Your chances of conversion are slim, but I'd like to put you on 3 antiviral medications: nelfinavir, zidovudine, and lamivudine. There are side effects: headache, nausea, vivid dreaming. You'll be tested for HIV in 6 weeks, 3 months, 6 months.
Maybe you should go home, take the rest of the day.
I'm fine.
Well, this is good. He's pretending to care. You're pretending not to.
I think we should reconsider drugs. Calvin uses crystal meth.
Concerned enough about his health to stalk me while indulging in deadly street drugs. Studying contradictions. Interesting, but still not medically relevant.
It could be, if his drugs were tainted. They cook meth with battery acid, lye, lantern fuel.
Find Calvin's pills, test for toxins.
No drugs in here. I'll take the bathroom.
How about a drink after work? Take your mind off what happened. Camera?
I might have HIV. A drink's not gonna wash it away.
There's like 0 chance of you contracting the virus.
Big difference between like 0 and 0.
What did the infection control guy tell you?
He was very reassuring. Kept reminding me that the hospital covers all my medical costs. Apparently forgot to mention that if I do test positive, that they'll pass it on to legal, and legal will dig up any dirt they can trying to prove that I'm a drug user or tramp, and that's why I have HIV.
It's not like they're gonna find anything, right?
Right.
I'm sorry about what happened.
It's best not to talk. When you feel a sharp pinch, this actually is gonna grab a piece of your lung.
What were you guys looking for at my hotel?
Your drugs? Thought maybe you'd used toxic meth. We'll know if you were exposed to beryllium in a few hours.
Well, if you're still curious, it's in my bag over there in the chair.
You brought drugs into the hospital? Glad I wasted my time at your hotel.
I told you I used. You didn't ask me for a sample. You're not pissed about this. You're mad because I coughed blood on you.
That was an accident.
Would you stop being nice? It's useless, and worse, it's boring. Get angry. I had one stupid night, I ended up with HIV. Do you have any idea how pissed off I was?
This wasn't your fault.
How are you holding up?
I'm fine.
Convincing. What do you do with my drugs?
The lab disposes of them after analysis.
Too bad. They could have done you some good.
Not really my thing.
You know, I hope you don't have it, but getting HIV might have been the best thing that ever happened to me. I used to be a good boy. Never wanted to piss anybody off. Playing by the rules makes everybody else happy. Now I'm happy.
Glad you changed your mind about that drink.
Come on in.
You should get changed. There's this new place on campus that looks... Are you high?
I had disposed of the drugs.
Not all of it.
Slow down. Your pupils are dilated. You're not...
Come on, Chase. Don't turn into a good guy on me now. Calvin lied.
Yeah, that certainly is shocking.
Mom's kidneys were failing. She needed a transplant. They tested Calvin. He was a match. He was also positive for HIV. Mom never found a qualified donor. She dies.
Tragic tale. Undercut slightly by the rapid-fire delivery and constant movement. Too much coffee this morning?
You didn't kill her. Our bodies aren't donor farms for our parents.
It's not 1980. We know how HIV is transmitted. If Calvin got HIV through unprotected sex, Dad has every right to be pissed.
So you always use a condom?
Yeah.
Brothers on the down low, got to.
Not ready for any Foreman Juniors yet.
You?
Working girls are sticklers. You're not gonna pull Chase?
I'm not an idiot.
Obviously not. Who doesn't sleep with a drugged-out colleague when they have a chance?
Ativan. It'll help settle you down.
Why are you so calm?
Not coming off meth helps. Last night probably shouldn't happen again.
Do you think I wanted to?
When two people have had sex, unless it sucks, if they can do it again, they're gonna do it again. And that's when things get complicated. And it didn't suck.
You lied to me.
If this is about my mom,
This is about your lonely, miserable life.
I'm not miserable. And as long as there's a gay bar around, I'm never lonely.
You haven't had a single visitor except for your dad. Drugs are great. HIV freed you. Your dad hates you. You're so happy. Everything's a lie. You blame yourself for your mom's death. You're not trying to have fun, you're trying to self-destruct. You want to kill yourself? Fine, but stop recruiting.
Scariest 30 seconds of my life. I couldn't do anything. It's like I couldn't move inside my head.
It's called abulia, the inability to make a decision or exercise will.
Is it gonna happen again?
It's part of a TIA, a transient ischemic attack. Blood was cut off to a section of your frontal lobe.
Is it like a stroke or something?
A little. What drugs have you taken recently?
No drugs.
Toxins are another possibility. You might have been exposed to something at work, for instance.
No real job right now.
Exposure can build up over time and lie dormant for a while. What was your last job?
Pet store.
Exotic pets?
Tropical fish.
And before that?
Unemployment. And before that, I sold subscriptions on the phone. And before that, unemployment. Before that, I worked at Jeans Gone Wild. Before that, unemployment. Before that, I walked dogs. And Before that,
Loss of free will. I like it. Maybe we can get Thomas Aquinas in for a consult. What caused the TIA?
Arteries are clear, no sign of a clot.
Could have dissolved. Most likely came from her heart. We should do a bubble study.
Clots are unlikely in a 28-year-old's not on the pill. It's probably a vasospasm caused by drugs.
I don't think so. She goes from job to job. Maybe there's some kind of ADD here. Help us pinpoint where the neurological...
She goes from job to job because she's a scam artist. She works just long enough to qualify for unemployment, then gets fired and gets high.
I still don't think it's drugs. Did you check for infection?
LP showed nothing, no fever. White blood count is normal.
Could be toxic exposure.
You're the one always saying it must be drugs.
You figure she's a minority? She must be stoned?
You know that's not what
She seems like a nice girl.
You haven't met her. She was pregnant at 15, dropped out of high school. She's a real overachiever.
Come on, cut her some slack. Her baby died of SIDS.
This isn't some romantic story about a nice girl scarred by tragedy. She's a drug-using scam artist scarred by tragedy.
On the other hand, her tox screen just came back. She's clean.
You're wasting my time. He's wasting...
What's life without the ability to make stupid choices? She needs her free will. Find out why her brain froze before she can't decide to take her next breath. You find the toxins, you run your bubble study. You don't find anything, I'll get the office to myself. There's a lot of porn piling up on the internet. Doesn't download itself.
that isn't mine.
It was in your closet.
It belongs to this guy who used to live with me.
You might want to let him know he's got arsenic poisoning. We should get a sample of his hair so we can see the extent.
But I don't do... I don't do drugs.
Get a crash guard in here. Respiratory arrest. Suppose it's an autoimmune disease. What's the biggest danger of total body radiation? It suppresses the immune system, which is what we're trying to do with the steroids anyway.
I don't usually put out on my first date, but I gotta say, that is a rad move. Get her consent. Start the radiation.
How do you feel?
Weak, sleeping a lot.
That's normal after radiation.
Deep breath?
A little queasy, too. When I feel sick to my stomach, I always want vanilla ice cream. It's soothing.
It's best to stick with liquids for now.
Shh. I'm getting a murmur.
Oh, my arm. It's hurting me. Take it off! Take it off! Oh! Oh! Oh!
Pain is the issue. Just the pressure of the BP cup was enough to start her screaming.
That's not cancer. It sounds like...
Sounds like she's septic.
A lot of things can cause pain.
How much pain?
Too much.
It's not cancer. It's not autoimmune. It's an infection, and we fried her immune system.
But she had no fever. Her LP was clear.
Do an echo to confirm it's in the heart. And then I'll tell our patient that we just killed her.
I'll tell her.
Hey. How come no mask?
We think you have an infection.
Didn't the radiation work?
Did what it was supposed to do. You're dying.
What do you mean, like things are bad and then someday I'm gonna... How much time? How much time?
We can't know exactly.
A year? Less than a year?
Less than 24 hours.
I don't understand. Why are you saying this to me? You're trying to scare me? Why would you do that?
I'm sorry. It's true.
How bad is this cancer? Yesterday, you thought I had a chance.
You don't have cancer. You came in with an infection. We didn't catch it.
What kind of infection?
Doesn't matter. The radiation was the worst thing we could have done. We destroyed the part of your body that was fighting it off. It spread to your heart.
Then give me drugs. They have drugs for infections?
Antibiotics work with the immune system, but your immune system is non-existent because of the radiation.
If it's my heart, you can get me a new heart. People have heart transplants all the time.
It wouldn't help. Infections everywhere. There's nothing anybody can do.
What do you want? Want to see if I'm dying on schedule? Or do you want me to tell you it's all right? I'm okay with it.
I'd like your forgiveness, but I don't expect it.
Good. Because this isn't like you ran your cart into mine at the supermarket.
No. Your grandparents haven't arrived yet. If they don't make it on time, is there anything you'd like me to tell them?
Never really knew them.
You got any friends you want me to call?
It's the middle of the night. They're not the kind of friends you ask to help you move, never mind watch you die. I never did much. No kid to leave behind. When I go, the world's not gonna be any different. Kind of a relief for you, huh? Aren't you ever gonna leave?
No.
I am fighting a guerrilla war.
In a way that's been called genocide.
20 years ago, these same Satibi rebels took over the South. They massacred tens of thousands, and they would happily do it again. I'm trying to impose order. I'm trying to prevent a genocide. Genocide. My own son, my youngest, he is a student here. He hasn't spoken to me in years because of what he read in your newspapers. But what he read is not true.
What about your youth labor league?
There. I was at fault. I hired men who, in their zeal, stepped over the line. And there were abuses. But that will not happen again. Inject my IV with an air bubble.
What are you doing?
I will have another heart attack. No one will know.
Let it go.
You tell my colonel I'm a sick, dying old man who can't be trusted.
I didn't say...
You were trying to put a gun in his hand and point it at my head. The gun is now in your hand. That is a practical difference, not a moral one. If you want me dead, then pull the trigger. It is not so easy when you have to do it yourself.
Allison.
I guess I didn't want you dead.
If you touch my wife again, I'll kick your ass out onto the street. I don't care who you are.
I did her a favor. I showed her her true character.
She's a better person than you are.
She is too weak to act on her beliefs. That is not her fault. Most everyone is. Even my own advisors, my own colonel, all they do is negotiate and debate and sign treaties. They are appeasers. All the while we are beset by assassins and traitors, the scum.
The cockroaches? What are you gonna do about them?
What is an enemy to you? Some younger physician who covets your office? In my world, there are dangers and bloodshed and death. And that makes you a man. And men make choices.
And your choice is to send bands of drunk, crazed children to massacre an entire people?
Don't ask me questions you don't want to know the answer to.
I saved your life. I deserve to know what you're planning to do.
Whatever it takes to protect my country.
We need a blood sample. We gotta do the anti-centromere antibody test. It'll show House is right. It's scleroderma.
Why are you doing this now?
Because I didn't want to kill him. And you're right. I have to take a side. So I'm gonna do what I can to keep him alive.
I'll get you the blood.
O2 sats down to 88.
Going through the main stem bronchus into the right upper lobe. Get them out of here.
No!
It's okay.
Bleeder.
Cauterizing.
Got it?
Yeah. Get the paddles. Going back in.
What is happening?
He's bleeding into his lungs.
Charging.
Another bleeder. I can get it. Hold on. There's a third. God, there's a dozen. Shock him.
Clear. Charging. Clear.
Went down to the morgue to rerun the antibodies test.
You ran it twice.
Turns out I couldn't get in. They had an armed guard. But I saw this. It's a sign-in sheet from the morgue. Your signature. 9:45 this morning. It's right before you guys ran the test. What were you doing there?
Follow up on a clinic case.
What case?
You think this is really important?
One of the patients in the morgue was a 70-year-old woman who had scleroderma. You and Cameron, if you took that woman's blood, you could have messed up the test results, so we treated Dabala for the wrong disease.
Cameron had nothing to do with it.
You son of a bitch.
He was going to kill the Satibi. Every last one of them.
I don't care what he was gonna do. He came to us and put his life in our hands.
All the good we've done. Every life we've saved. It would have meant nothing if we just sent him off to kill hundreds of thousands of people. Look at the news. The moderates are taking over. There's hope for peace talks. You tell the world that I faked this test, Dabala becomes a martyr. The massacres begin.
I cover this up. I become your accomplice. You think you can guilt me into that?
If the cops are going to come for me, please warn me so that I can tell my wife first.
Chase, you You really think you can kill another human being without any consequences to yourself?
I can handle this alone.
You've already handled it. That's why you need a chaperone. Of course, I'm a very permissive, understanding chaperone, so feel free to ignore me. You know, if you're in the mood to start kissing or groping or showering.
You'll have to excuse Dr. House. He mistakes immaturity for edginess.
You're Dr. House?
I assume my name came up last night in the form of a moan. You had sex, then a seizure. Could be a particular position or activity that set it off. It sounds like a valid medical theory, doesn't it?
I'm really sorry. Just ignore him.
Whatever you think we did, we did. And then some.
Lights on or off?
A medical rationalization for that one?
Light sensitivity could be.
On.
Huh. Figured you had more shame than that. She talk dirty or make you rely on vague hand signals?
She's pretty direct about what she wants.
I'm learning so much. Okay, score the score. Scale of 1 to 10.
Don't answer.
7.
I only got one right.
Should have known it wasn't a coincidence. Found your letters. You recognize House's name, and you're the first patient I've seen who actually enjoyed being accosted by him.
I would have told you, but...
What exactly would you have told me? That you slept with me to get to House? That you've been trying to get him to take your case for over a year?
I'm sick. No one even wrote back.
You used me.
You used me.
My motives were clear.
You might have figured out my motives faster if you'd bothered to ask my name. I followed you to that bar because I wanted to talk to you. See if you'd help me get to House. I didn't expect you to be so aggressive.
Was that seizure even real?
Why would I fake a symptom? It would just make it harder for House to diagnose me.
There's nothing to diagnose. Your biopsy results were negative.
Then it's something else.
Get dressed. I'm discharging you.
House admitted me. He obviously thinks...
House is using you as an excuse to stick his nose in my personal life.
I'm tired all the time. Some nights I fall asleep at 10 and wake up at noon, still tired. Every doctor I see tells me there's nothing wrong.
And that proves what exactly? That they're wrong or that you're wrong? Come on, you expect me to believe? Sit back, deep breaths. Try and relax. Get the paddle, she's gonna crash. Damn. We had to use paddles to stabilize the patient's heart.
Eye issue, brain issue, now a heart issue. Sounds like a real case to me.
Yeah, I get it. I was wrong. Can we move on?
You were just upset because the whole time she was with you, she was thinking of my huge, throbbing diagnostic skills. Drugs would explain everything.
This morning you rejected drugs.
That's when I thought the 13 was right and I was just jerking her around. Cardiac arrest means she could be a serious user.
Great.
What?
That means that something she did at my place set this off. Either she brought drugs in or she grabbed something from my medicine cabinet, and that means my place needs to be searched. Now, I'd be happy to do that myself, but unfortunately that would be far less titillating for House, so he's about to come up with some convoluted medical reason why I have to stay here while he goes through my stuff.
Patient's dad had bypass surgery. I mean, she's a candidate for atherosclerosis. She needs an ultrasound. That was much less convoluted than what you just said.
I'm not giving you my keys. If you want to do this, I'm going.
Who could pick a lock?
I'll go. Make sure he doesn't steal any underwear.
Blood test confirms low potassium levels, explains the numbness in her hip. It's not good, but I think we've got time for at least 1 or 2 comments about my personal life.
Which you just wasted with that comment about my comments. Low potassium means her heart problem is a symptom of kidney problem. What caused the kidney problem?
Could be IgA nephropathy.
Not without blood in the urine.
PSAGN?
Not with normal blood pressure.
Renal tubular acidosis. Her kidneys don't filter acid out of the blood. Excess acid drives down potassium, causes kidney calcifications.
It's RTA. All she needs is sodium bicarbonate for the acid and surgery to remove the calcifications. CT her kidneys. If you find calcifications, we have her diagnosis.
The breathing problem started after we fixed her kidney problem. means the RTA isn't the underlying cause.
Where's 13?
Traffic's bad. She's probably just
Not here.
It's not her lungs, no masses, no infiltrates.
Her lungs are working, but she still can't breathe.
Distribution plant can't distribute if it's not getting deliveries. If her lungs are fine, maybe the problem's in the supply line, airway collapse.
That could signal autoimmune or some kind of dystrophy as the underlying cause.
There's only one way to find out if her airway failed. Make it happen again. Stick 13's carpet cleaner on a treadmill. Methacholine challenge. And someone find the carpet.
I found her in the clinic, giving herself IV fluids.
At least you could let her finish. She looks terrible.
She has a fresh nightclub stamp on her wrist. She's in no condition to practice.
Unless this is a prelude to an actual spanking, there's no reason for me to be.
I want her to take a drug test.
You can't make me do that.
But I can suspend you until you do.
Because she went to a nightclub in her free time? Or because she had sex in her free time? Patient was undergoing routine surgery for RTA. Didn't need 13 here for that. And I don't need you making my employees punch a clock or pee in a cup. Let's go. Come on.
Thank you.
By the way, the surgery was not routine. Patient stopped breathing, and you missed the differential. You're fired.
What? You just defended me.
No, I just prevented you from getting a drug test. Probably saved your career. But I'm already taking responsibility for one doctor with a drug habit.
I don't have a drug habit.
A slutty party girl is fun until she pukes on your shoes. And she's just a pain in the ass.
I heard.
Yeah. I'm looking for my ticket back.
Sorry if I upset you. I didn't want to invade your privacy.
It wasn't your fault. Can you get me caught up?
Think you're gonna find something we did?
It's good for the patient. Good for me.
Films are clean. We ruled out hypertension. The guys have her on a treadmill running a methacholine challenge. And I still think you've been acting like an idiot.
I know. Did you talk about whether this lung field looks a little dark?
It's probably just overexposed.
Or her diaphragm's a little flat? Could be a sign of hyperinflation.
Suggests a pulmonary obstruction.
Lung cysts. They wouldn't show up on an x-ray. Treadmill test isn't gonna close her airway. It'll make her lungs explode.
Her throat's fine. We made her airway collapse, but it's not collapsed.
You ruptured a cyst. Her lung collapsed.
Breath sounds on both sides.
Move. Trachea's deviating to the left.
Nice.
It's back. This is where the pain all started. Ow!
She's tachycardic. Get a crash cart in here.
Ow!
What's going on? I need to know what's going on. That's my daughter.
Her liver's failing. It's not SARS.
Nicole had a clot in the hepatic vein. Chase sucked it out, saved her liver.
No signs of a tumor or venous malformations. Nothing that could cause
She's an addict.
drugs and alcohol.
She's a
wouldn't-
smoker. Combine smoking with any one of a dozen genetic disorders, and she's a clotting machine.
Multiple blood clots would tie together bowel ischemia, lungs, and the liver.
Need to pinpoint which defect she has so we can start her on the right anticoagulant. Draw her blood. Let's find out which genetic gift her genetic parents gave her.
We have these two categories, inside and outside. Patients stay inside, and then when they're better, we let them go outside.
Thanks. But they don't let you smoke inside. So why don't you go back there and give me 5 minutes outside?
Make a fist. Such a beautiful day, we thought we'd do all our doctoring outside.
People stare at me anytime I'm out with my family. It's like a puzzle. Which one of these things doesn't belong?
Belonging's overrated. I was adopted by a white family when I was 9. I like being different. The view's better from the outside looking in.
Must be easier to be different when you're a success. Is that a problem?
This is why we prefer inside.
Nicole, lie still. This will only take a few seconds.
1mm cut through upper abdomen.
She was adopted when the parents thought they couldn't have kids. Then they had 3 more. She took the message as thanks for playing, but we have our real children now.
And the real children probably think they're accidents while she was handpicked. Everybody's got problems with their parents.
She's an addict. Something went wrong.
And it has to be the parents. Magnifying pancreas.
I'm not saying the parents screwed up.
You're saying you like her, so you don't want her faults to be her fault. But they're someone's fault, and the only other people you know are...
CT confirmed gallstones. Normally not dangerous. Almost everyone has them. But sometimes...
They kill you?
Yep. Unless I take them out. We do it laparoscopically. How long has her urine been brown?
Kidneys were fine this afternoon.
They're not now. It's not the gallstones.
Differential. Say you're a middle-aged Chinese woman.
Fine.
Say it.
I'm a middle-aged Chinese woman.
Girl comes to you, says that she's your long-lost daughter. How would you be frightened?
I'm frightened because she's a threat. Maybe she knows something.
She hasn't seen you since she was an infant.
Maybe an inheritance issue.
You're peasants.
Her very presence is a threat. What year was she born?
83.
She's not supposed to be alive. China introduced the one-child policy in 1979. Say they didn't want a girl. They tried to kill her.
Maybe the baby doesn't die. Maybe the father panics or regrets it, takes the baby to an orphanage. Maybe he doesn't tell his wife.
Who freaks out like she's seeing a ghost 25 years later when the girl shows up?
Why does attempted murder from 25 years ago have suddenly become relevant to her health now?
Maybe they gave her something toxic. It would have to be fat-soluble.
This is fun, isn't it? Let me see the MRI.
We don't have one.
She started vomiting as soon as we started the scan.
I'll let her vomit through the MRI. That's what nurses are for. Her parents tried to kill her. I don't know how, but I know it caused her to get sick 25 years later trying to lift a Buddha. Explain. I already had this conversation with Wilson. Just go with it.
Poison?
Buddha wouldn't make it worse.
Maybe the weight stressed her back, which...
Makes sense if she's never lifted anything in her life.
She actually didn't get sick till she tried lifting it that second time. I'm guessing the weight changed.
Anybody have Taub's pager number?
What's up?
Maybe give him a call. He tosses that switch on the MRI, she's dead. X-ray her brain. Pins. Push them through the soft fontanelle of an infant. You skewer the brain, and the hair hides the entry wounds. It's the perfect crime.
She's had them in her all these years.
What changed at the temple?
Same thing that changed in the MRI. Shockingly, not all religious leaders are honest. I'm guessing these particular monks are bilking the faithful by pushing a magnet up Buddha's butt. There's another one under the table that'll repel or attract depending on how you shift them. And she picked up that magnet and moved one of the pins deeper into the sympathetic nervous center of her brain. This sent a signal through the nerves to the blood vessels in her small intestines. Caused the symptoms in China and in the giant magnet we call an MRI. She's lucky. We're all screwed up by our parents. She's got documentation.
The pins will be removed surgically and she'll be fine. We'll wake her from the coma after the operation.
Is there any way you could not tell her?
Please. She's fragile. She desperately wanted to know her biological parents. For her to find out that they wanted her dead, I don't know what that'll do to her.
She may not be as fragile as you think.
We know our daughter.
See this pin here? It's been pressing directly on her addiction center. It's not her fault, and it's definitely not your fault. She's not who you think she is.